Welcome to 2021 Medicine for Good podcast. This is the doctor's near death experience with COVID 19. Day one, I started coughing and my body felt so weak and so painful as if a car hit me. Oh, this must be COVID. Became worried, scheduled the swab the very next day, and 12 hours later, here comes positive test for COVID. I continued coughing, felt really tired and weak, unable to eat, and even able to get up to even go to the bathroom. The virus really enveloped my entire body and make me so helpless. I did not realize how bad it has gotten until the day before day 6 or day 7 that I could not even communicate through the telephone because any effort to speak led to an unrelentless cough. Couldn't breathe, couldn't talk, couldn't walk. My sister begged me to check myself into the hospital. And I asked why or what for. They will not do anything. I know all the data of what we can and cannot do for COVID. I still have the presence of mind that I would not qualify with any other possibilities like oxygen, remdesivir, or any decadron. The very next day, my colleagues called me and I could not even initiate a conversation. They got so worried, they called 911. I was even so weak to even resist that. Um, 911 came within minutes, and I felt embarrassed. I felt that this is really a horrible use of resources that could otherwise be used for other people. I did not want to lay down on the stretcher. I insisted that I walk into the ambulance. Few steps made me really sway to different direction. The calming voice of the paramedic and the oxygen helped so much that I felt that I could actually breathe. The trip to the emergency room made me aware of how weak I had gotten and but still felt that I didn't have the reason to be at the emergency room. At the ER, either because I was a faculty or I looked really terrible, despite a normal pulse oximetry or normal oxygenation, I was given Decadron by the resident at the emergency department. I felt an hour after the Decadron that I could actually move, I could actually breathe, and I could actually fight this virus. Got into my room at the hospital. The oxygen helped me calm down. I actually had the little energy to get up and start walking. The steroid made me pace all night long. And I was glad that I did because I was able to get up and walk, um, and actually felt that I had jump started my body to fight this virus. The very next day, I could say, I am okay to fight this virus. I insisted in going home, got the 2 doses of remdesivir, got also 2 doses of Decadron. I had few more days packed for Decadron to continue at home. At home, started having fluids, uh, able to speak without coughing incessantly. And it was that time that I felt that that timely 911 call saved my life. The effort of my colleagues to call 911 saved me. Being inflicted with COVID, it's such a hard experience that the actual virus could take over your entire system and you're not able to fight it. I felt really close to death and I didn't even realize it. Dialing back 7 days prior, I had actually the first dose of my vaccine. I think that vaccine also gave me a little bit of ammunition to fight this virus. 9 months prior, I spent my time learning about the virus, participating in active studies for COVID 19, read almost every literature on COVID 19. Did that really prepare me to face this virus? I didn't think so. My experience underscored what I always preach to my medical students: let the patient be your book. Listen to them, observe them, and do not just rely on numbers. Those statements echoed in my brain during this experience with COVID. I am a week off now from my hospitalization. I still feel very weak, but I know I can do this. Having COVID is a different experience, I believe, because there are no people there next to you to hug you, to connect with you, to help you. Despite that, lots of friends and family reached out, but you can't even generate that energy to be able to connect with them. So what have I learned from this experience? One is keep the connection going with people throughout the illness. Let people help you. We will continue the fight against the virus. For now, all we have is following public health measures because the virus is still surging all over the country. I would insist on masking, maintaining social distancing, avoiding crowds, and only go outside when it's necessary. Being outdoor and helping yourself continue your strength, your energy is important. I would like to insist on what I would call RISE, which R refers to resiliency. Take care of yourself, give yourself all the immune boosting that you could possibly get. I stand for innovation, not just innovation for ideas to help COVID, but innovation in terms of your own schedule, innovation in terms of being able to help others, innovation in terms of looking at what you could possibly do for yourself and for others, diverting your interest to gardening, to things that could give you positive energy. And S refers to service and sharing. I think service to others and continue sharing what you have is very important during this time. And empathy, I could not underscore the importance of empathy. So, to my audience, I hope my experience as a physician would help you realize how important life is, how important service to others is, and how important is taking care of yourself. Please continue the public health measures, have the vaccine, and continue servicing others. Welcome to 2021 with renewed hope and continued energy and strength to help fight the virus and help fight humankind. Thank you so much.